Let food be your medicine. And in this segment, we are talking about another very, very important condition. And we are talking about gastritis and gastroesophageal reflux. Let's look at the introductory video right away.
There is a close relationship between acidosis and the occurrence of gastritis. In fact, acidosis is the direct cause of gastritis. In fact, on the walls of the stomach there are cells called parietal cells, which have intracellular canaliculi and proton pumps, which upon stimulation initiate acid secretion. This process uses carbon dioxide and water to produce hydrogen ions, H+, and bicarbonate ions, so these cells produce both hydrochloric acid and bicarbonate at the same time. In this way, the stomach is able to digest food while protecting itself from acid through the basic mucus on its walls. But parietal cells are also used by the body to produce bicarbonate, which is useful as a buffer system to keep the pH of the blood in balance. But this at the same time induces the production of hydrochloric acid in the stomach, but in the absence of food to digest.
Here, this video was telling us about acidosis, which of course causes gastritis. So I also want to ask our Dr. Orlando right away why sugar causes acidosis.
Yes, so basically gastritis, let's say, is divided into acute gastritis and chronic gastritis, essentially. Acute gastritis is due to an inflammation of the gastric mucosa, precisely of short duration, usually leaving, let's say, no consequences, unlike chronic gastritis, which is essentially due to the excessive presence within the stomach of a bacterium, which is Helicobacter pylori, which tends to be a good bacterium, let's say, inside our stomach, whose imbalances, however, due precisely to a decrease in our immune system, causes it to colonize our stomach and thus give rise to various situations, pathologies, including even ulcers up to polyps and gastric cancers. As far as nutrition is concerned, then sugar, because gastritis is essentially due to the fact that the moment we have glycolysis, so as a result of precisely the assimilation of sugar, our pH at the level of the body goes into acidosis. So acidity is created, acidosis is created. At this point, the cells precisely of our stomach that are deputed to produce bicarbonate, mainly to protect the mucosa from hydrochloric acid, therefore they are forced to direct this bicarbonate into the tissues to precisely make sure that our pH is kept constant. This causes them then to have less bicarbonate precisely available to the gastric mucosa to counteract hydrochloric acid. Also, it has been seen precisely that intestinal dysbiosis due to a diet rich in sugar stimulates, as we said, histamine, which also has a receptor within the stomach that induces the production of hydrochloric acid. This in nature would be good because it serves to also go to kill any bacteria inside the stomach. However, an overproduction precisely of histamine, which as we saw earlier, is due to the inactivation of the DAO enzyme that should inactivate it, and cortisol. Which precisely goes to stimulate lately the production of histamine. We go to bring precisely an excessive synthesis of hydrochloric acid in the absence of bicarbonate that serves to protect the mucosa of the stomach. So all these, as we said, all these factors cause the intestinal mucosa then to be exaggeratedly subjected then to the action of hydrochloric acid. Another situation precisely that is created as a result of inflammation apart from gastritis is also gastric reflux, which as a result of precisely inflammation, there is a valve called the esophageal sphincter which should close properly to prevent acid reflux from the stomach to the esophagus. This precisely as a result of inflammation, there is a failure or incomplete closure of this valve which causes this acid then to go up to the esophagus, giving the burning. Unfortunately, often this symptomatology is also confused with the symptoms of a heart attack. So a heart attack, and I also find myself in several patients who go to the emergency room thinking they have a heart attack going on, when in fact it is reflux exactly. And another symptomatology that delays the correct diagnosis to the doctor is also a respiratory tract symptomatology, because we often have cough because we have this acid that sticks to the throat. So we have cough and also kind of whitish substance, let's say, in the mouth that is often acidic. So we realize that it is reflux acid. Sometimes it happens, however, that you don't have this sensation, so you think it's mucus, and then at that point the doctor starts with antibiotic therapy as if we have a flu, when in fact we have precisely reflux. And what does that do? It brings on precisely the inflammation, it brings on the growth of Helicobacter pylori, because that, and then
Helicobacter pylori, I have to interrupt you on this, however, Dr. Orlando, because I have to move, obviously, to the argument to our Adriano Panzironi. The Istituto Superiore di Sanità gives us, let's say, causes of gastritis, a whole series of reasons, and does not put, first of all, the diet, let's say, so with insulin carbohydrates, but above all, it blames a Helicobacter pylori infection, which is therefore our enemy.
It is an enemy that is thought of as such, but in fact it is an innocent. Not surprisingly, by the way, the treatments that are provided for those who suffer from Helicobacter pylori, which is a bacterium that we basically all have in our stomachs, and it has the particularity precisely that it also produces bicarbonate, a bacterium that can live at high acidities, and therefore it is obvious that it also survives stomach acid, including, of course, acid. Hydrochloric, well, obviously, what do? You use antibiotics to kill this bacterium, to try to eradicate it from our body. Actually, what happens when we have chronic inflammation, that once we have, obviously by eating bread, pasta, pizza, potatoes, rice, and legumes, reduced, let's say, this basic mucus that is protecting the wall of the stomach, we expose this wall, which is basically made of cells, obviously, to hydrochloric acid. When you have damage, that can also lead to ulcer, which we will later say, because ulcer today is no longer a problem. But when you damage these cells, then this bacterium infiltrates this tissue made of matrix of cells and induces persistent inflammation. But the problem is not the bacteria basically attaching to a wall that no longer has that basic mucus. It's that we have prevented from keeping intact that structure that nature had made for us, which was precisely a layer of basic mucus underneath, which precisely is a protein structure made of matrix and cells. So the problem, if you solve it by allowing our stomach to restore that basic mucus, at that point, even where there were bacteria that penetrated inside the matrix structure, we have a very efficient immune system that is able to kill it by itself. We don't need antibiotics. So the problem, if anything, is the carbohydrates, not the bacteria. And I must say that when you get to very high percentages of community society suffering on a pathology, you can no longer talk about a food-induced pathology. But the normal consequence from a wrong diet, that is to say, if we decide tomorrow morning to eat nails, it is not that we can then complain if these nails then make holes in our stomach and intestines. And this happens when we eat the excess of carbohydrates. We naturally induce the lowering of this mucus. So the thinning of this stomach mucus, we induce acidosis, we induce a whole series of things whose normal consequences, of course, the appearance of the reflux of gastritis, from which more than 90% of the population over 40 years old suffer from.
Here I want to insist on reflux, again the National Institute of Health, because we have obviously gone through everything we are told. Reflux disease. The cause is, as our Dr. Orlando said, from the weakening of this valve that is at the upper end of the stomach and anyway lower end of the esophagus. However, Mr. Panzironi, perhaps this news will not surprise you. He does not blame sugar.
To what? The spices?
I'll tell you this with all the clarity. We've always been known for practically blaming anything else, but these sugars think they also blame fats, but not sugars. So for both gastritis and reflux, the sugars remain, let's say.
They always blame fat because medicine obviously puts two and two together as a logic. So fat makes you fat. And obviously cholesterol is bad for you. All these things here, it is obvious that when we eat a food that is very high in fat and protein, the food persists in the stomach. So for reflux sufferers, we have increased symptomatology. The problem is because there is symptomatology, not because obviously the food stays there. And then by staying there, we have a greater effect of the pathology because we have seen so many people doing Life 120 that yes, they took out the carbohydrates, they increased the fats, and the reflux still went away.
I can testify at this point. In 1 week, I resolved. I always stated it, so there is nothing new in this news, so don't be all surprised. I always stated it. In 1 week, I resolved the reflux. I was practically sleeping standing up. But for that now, I want to move on to another thing. I want to talk about numbers. And so I asked the director to air the video on the numbers of reflux and gastritis.
Gastroesophageal reflux and gastritis are among the most common diseases in Italy and Western countries. The percentage of people suffering from them in our country is up to 50% of the population, so about 30 million Italians also suffer from them concomitantly. In addition, very often hiatal hernia is also associated with these conditions. The treatment of gastroesophageal reflux and gastritis involves constant and lifelong pharmacological treatments for patients, since they aim to relieve the symptoms but not the causes. The most prescribed drugs are antacids, histamine antagonist drugs, proton pump inhibitor drugs, and prokinetic drugs. Antacids used are alginates that reduce stomach acidity. Histamine antagonist drugs are able to bind histamine HII receptors, preventing the production of hydrochloric acid. Proton pump inhibitors prevent stomach cells from secreting hydrochloric acid. Prokinetic drugs stimulate motility and accelerate gastric emptying.
So then 50% of the population, so about 30 million Italians, suffer from gastritis or reflux. And even maybe sometimes concomitantly, Mr. Panzironi.
What we've seen in this video is basically all the drugs that dogmatic medicine has come up with to block some metabolic function of our body. So it has the drug that blocks acidity, the drug that blocks the proton pump, the drug that blocks this one, blocks that other. So we, in the face of a metabolic alteration induced by a food, we don't think of removing that food that induced that alteration, but we take drugs that go to block metabolic functions, hoping that then this won't bring us other problems. Instead, exactly the opposite is the case, because most of the people who use these products then have significantly worsened health problems, because if the stomach has to digest proteins, and it does so at a certain degree of acidity, and that degree of acidity also serves to protect us, example, as we saw for the histamine talk, to kill bacteria that are naturally present in food at times when we raise the pH and therefore prevent the stomach from properly breaking down proteins. We will have a passing effect both of bacteria that go to colonize obviously our intestines, but also a greater presence of proteins that are not separated from them, because in proteins there is proteolysis that basically goes to reduce them to single amino acids or bipeptides, and those easily are then assimilated by the intestine. But if we break that protein in half and then think that it doesn't somehow induce fermentation or putrefaction within the intestine, we are deluded. So rather than going to block metabolic functions that obviously create even bigger problems for us in our digestive system, we should obviously think about removing those foods that induce those alterations.
Because we understood that anyway, nutrition and supplementation go to give benefits on our whole body, on the upper digestive system, it should be even more right to act then on nutrition and supplementation. So just on nutrition and supplementation, Dr. Orlando, can something be done?
Yes, certainly, precisely. The digestive system is usually the first apparatus that, precisely being in direct contact with food, is the one that is affected both positively and negatively. In fact, precisely those who have these pathologies usually changing their diet really solves them in a very, very short time, from a week to 10 days, a couple of weeks. In short, really the symptoms disappear completely, and then also a good integration with, for example, aloe. So a very soothing ingredient, let's say, at the intestinal level, rather than always antioxidants with vitamin D and so on. Make sure that our stomach, our digestive system, rather than even the immune system, because then it is the one that suffers most. As a result of poor digestion, is put back on track also, because then, as we have seen, these drugs precisely that are given to counteract this pathology create a malabsorption of what we eat, precisely because there are precisely drugs that even accelerate the intestinal transit to make it stay as little as possible, precisely in the stomach. So we have in these people also deficiencies in vitamins, for example, B drugs, iron, calcium, then osteoporosis, precisely increased bacterial infections. So all of this leads pathology on pathology exactly cascading. So what we have to go and do instead, just by immediately changing the diet, is to reverse the direction, because then our organism from this point of view is a Ferrari, let's say. The moment it gives itself a good fuel, therefore not inflammatory, it reverses the gear, it detoxifies and starts working again in an appropriate way.
I go to Adriano Panzironi. So, always going back to the book, Living to 120 the Healings, what results have we had, thanks to the Life 120 lifestyle, on these types of pathologies?
Let's say that reflux and gastritis are obviously the most common diseases, and it is no coincidence that we decided precisely to treat them in this observational research, especially since out of 1,000 people, it was stated that they suffered precisely from gastritis and reflux. After starting the Life 120 lifestyle, 92% of the people surveyed stated that they were totally cured, 8% improved. Regarding the drugs that are normally prescribed clearly by the medical class, 96% no longer use drugs. So it means that obviously, in addition to the healed who naturally no longer take drugs, another 4% no longer use drugs and therefore still had an improvement from this point of view. 2% reduced the symptomatology, 2% did not change the medication administration anyway, even though they had an improvement. These are data that should give pause for thought, because we are talking about almost the entirety of people who definitely had a resolution and at worst an improvement. We always remember that gastritis is one of those pathologies that always occurs very easily, and especially when we start to suffer from it all, it takes this one wrong meal that the gastritis and reflux return immediately. So we think that these very high percentages of those who are cured basically manage to return from the point of view of the pathology in a very strong quiescence phase. Some, on the other hand, who maybe see every now and then suffer because they make so-called snubs, this momentary departure, maybe a step or two meals away from Life 120, and then they are affected by it, stating that in 8% of the cases they had an improvement but not a solution. However, this should also make us think about the concept that there are so many drugs. There is a drug industry that lives for the sale of drugs that do not solve the problem for the patients, because very often people who take drugs do not solve all the symptoms. They live with a less pronounced symptom, but still they have not solved it. And in any case, as we were saying before, you have an increase of high pathologies related precisely to the interruption of this correct acidity that our stomach should have to digest food. So the paradigm that needs to be changed in this medicine is that the doctor, before administering such a negative drug for our metabolism, should tell people not to take out the chocolate, as sometimes happens, not to take out the spices, as usually happens, but to take out the carbohydrates that are the basis of the Mediterranean diet.